Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Monday. It is April 8th. It is 5:04 p.m. Oh, this weekend went too fast, but here we are, Monday again. So we've been talking about screening tests, ones you may want to do, whether it be annual, every other year, every 5 years, every 10 years. And we did a bunch of women's topics last week, so this one is for you men that are watching, or for you ladies, for your husbands, boyfriends, fathers, brothers, whatever it may be. We're talking about prostate cancer screening. Now, according to the CDC, the goal of screening for prostate cancer is to find cancers that are high risk for spreading if not treated, and to find them before they spread. Okay, 2 tests are commonly used to detect prostate cancer, starting with what's called a digital rectal exam. Okay, sorry guys, but this is a must. A doctor will be able to feel your prostate by putting his finger in your rectum. The wall of the prostate is actually very readily palpated this way. Okay, and what they do is they can check its size, they can feel its texture, and they can check for any irregularities on the surface, which would give them some type of indication that there is something potentially going on. In addition, blood is drawn to check for what's called a PSA, which is prostate-specific antigen. It's a blood test. Now, this test measures the level in your blood of PSA, which is made by your prostate and can become elevated in men with prostate cancer. But also, other prostate conditions can actually raise that level as well. As a rule, the higher the blood level of your PSA, the more likely a prostate problem is present. Now, other factors such as age and race can play a role as well. So it's not just the number, it's sometimes we look at more like trends as opposed to a specific number. Okay? So it's often checked, the blood test is often checked annually, and the trend is followed over time to see if it's going up or down. Obviously, up is not good. We're talking point this, it's no big deal, but if it's going from 2 to 5 to 10 to 19, that is when it becomes an issue. Now, the U.S. Preventive Services Task Force says the decision to check is an individual one. The American Urologic Association recommends the greatest benefit for screening is in men ages 55 to 69, especially in those with a family history of hormone-sensitive cancers. So, family history of prostate cancer, breast cancer, ovarian, and pancreatic. And ideally to check every 2 years, not annually. Now, the American Cancer Society recommends a PSA for men over 50 with the average risk of prostate cancer and are expected to live at least 10 years. Okay? Age 45 for high-risk men, which is considered African American or with one primary relative diagnosed with prostate cancer younger than 65 years of age. Or in men beginning at age 40 for those with more than one first-degree relative with prostate cancer. Okay, so it starts to become a little bit more specific. So if you didn't catch all of that, you can go to the American Cancer Society screening, prostate cancer screening recommendations, and you'll be able to read them out yourself. Now, then they also recommend repeating your PSA testing depending on your level. Hello, Heidi dear. So if your PSA is less than 2.5, you can retest every 2 years. But if your PSA is greater than 2.5, they recommend testing annually. Now, the reason for this discussion is if you develop a higher PSA, the next step your doctor will recommend is a prostate biopsy. Okay, and ultrasound. Hey, Yuki dear. So it's not something that is benign at this point, okay? Men may not like having a digital rectal exam. Blood test, no big deal. But once they get to a point where if that number gets elevated, they want to actually do an invasive procedure such as a biopsy, then you have to know what your risks are. Now, the biopsy is actually the true test and is location guided by the ultrasound. And the biopsy is usually, though not one biopsy, it's usually 10 to 12 core samples. Okay, and can result in some bleeding afterwards. There can be blood found in the urine, in the stool, and actually in semen as well, and can also result in an infection. Obviously, anytime you're doing anything invasive, bleeding and infection are possible risks. So this is not a benign or easy step. So you don't want to screen unless you are willing to do the next step. Okay, I always tell people that if you're not willing to go the next step, you're probably better off just not knowing. Okay, if you are the type of person like I am, where if I screen, I will go to the next step, then this is one that you should consider for the men in your life. So, hello, Angela, darling. You're going to have to watch from the beginnings because I just about finished. So, we're going to be talking some more screening tests this week that are generic for most people. So make sure you are tuned in. Check in last week's because I did mammography, pap smear, and some other really important screening tests, colonoscopy, that are important for you to know what your risks are, what the recommendations are for doing these screening tests over the course of your lifetime. Hello, Joyce, honey. Hope you had a great day yesterday. Anyway, so thank you guys for watching. Please, again, watch these. Make yourself an informed decision and stay healthy. So I look forward to seeing you guys again tomorrow for another Live in 5.